try to straighten your thumb or finger and it gets stuck in a bent position, causing you pain or even a clicking sensation. That's trigger finger for you. But why does this happen? Inside your hand, there's a tunnel-like structure called the tendon sheath. Think of it as a protective sleeve for the tendons that allow your finger to move smoothly. Now, when the tendon becomes inflamed or irritated, it can swell, making it harder for the tendon to glide through the sheath smoothly. So, what can you do about it? Resting your finger with light motion that does not cause a trigger and applying ice at night is shown to be the best line of treatment conservatively. Once your finger locks, you gotta start the process over again, which can be really frustrating. But you're in luck because there's recent research that has shown that trigger finger that is treating conservatively with an orthosis at all time has identified an 81% patient success rate with an average return to work in 6 weeks. The study with only nighttime wear of the orthosis found a 53% success rate. Long-term outcomes at 1 year varied with an identified reoccurrence of symptoms in a 12% of the orthosis group within 1 year and 13% required injections or surgical intervention. Surgical intervention includes the surgeon cutting the A1 pulley and releasing the inflamed tendon sheath. This could be a 6-week to a year recovery depending on patient factor. Make sure that you ask a healthcare professional for the best advice with your particular situation. Finally, and most importantly, prevention is key. Decrease the amount of repetitive reps you do during the day. Stretch frequently and take breaks. Go check out our other video on how to treat carpal tunnel if you suffer from numbness in your hand.